one person's opinion here, but I'm in favor of a universal healthcare system that creates a standard base of treatment, no matter how young or how old you are.
Do you think this issue of knowledge sharing is going to become more central in the coming months and years?
Yeah, I think that there have been a series of events probably over the last 20 years that have certainly escalated the need and the want to share medical information very broadly in a safe and compliant manner. And what I mean by that is that very simple things from I should be able to access my patient who I'm seeing today and their medical information, regardless of where they've been in the past. I, as a patient, would love if that happened, and you have to carry around, printouts and CDs and DVDs or whatever else, right? The medical industry is in the dark ages compared to finance, for example, where you can move bank accounts electronically, transfer money electronically, things of that nature. And we see that vision for the medical record itself in order to help the patient. Now, in the let's say R&D and kind of discovery phases of medicine, we're just scratching the surface. So, we're very excited about all the things we can do in precision medicine, but, nature is got a lot to teach us, is what I would say. We need to be humble, and we need to be confident that we can keep going after disease. And the only way we can do that is with large data, and data of hundreds of thousands, millions of patients. And the only way you can do that is to integrate information in a safe and compliant manner that also respects patient privacy, patient rights as you do that. Mm-hmm. And this is not just for R&D, but also in the ability to use real-world evidence in managing your patient. In other words, today's paradigm is that there are research studies that result in, let's say, a paradigm shift in clinical care. And you have to design that study, you have to execute the study, you have to determine clinical significance, you then have to publish it, and then people have to know about it. I.e., they have to somehow read that paper or hear it from a friend or things of that nature. We'd like to turn kind of the practice of medicine on its head with this type of data sharing, because you can actually ask, well, how did patients like mine do if they were given treatment X or treatment Y in the clinical world, in my locale, as well as regionally or nationally, and how does that impacted by the patient's race, gender, ethnicity, as well as their genetic makeup, and that's when you can really accelerate the care in medicine, because you don't have to follow this official cycle of research and publication, which, although robust, is very slow. Because these types of, let's say, on the ground experiments in patients are happening every day, because you don't know what to do, and you only do it based on your own experience. And you may remember what a patient from 15 years ago that worked or didn't. And this is the type of information that, in a very quantitative way, can guide and help physicians make, let's say, the right decision to help the patient who's sitting right in front of them.
A couple of questions came up when this afternoon, I read a really thoughtful and interesting piece on the Pierian blog called Cancer in the Time of Coronavirus, written by an anonymous Pierian employee. And it's thrown up some really interesting questions, which I'd like to talk to you about. Sure. Your employee writes, the coronavirus pandemic is already affecting access to care for cancer patients. Some have lost their jobs and along with their income and their employer-provided group health insurance. One chemotherapy treatment without having insurance for me would cost $2,600, and imaging tests can be over $10,000. Now, several CEOs that we've spoken to thus far have highlighted the importance of accessibility in healthcare. So first of all, I'd like to ask you, how important is this issue of accessibility?
It's incredibly important, and if it's that difficult in the United States, can you imagine what it is like in the rest of the world, especially underdeveloped countries? Mm-hmm. The U.S. and its healthcare system, have its own issues with regard to the rising costs and the incentives that are, let's say in the wrong place to, treat patients. And we've got to fix that problem. And this is much bigger than precision medicine. It's healthcare as a whole. And you see other countries that are doing better at it, let's say, than the United States. It's incredible in this pandemic, for example, to see that the United States healthcare system can become crippled. And we needed to have the social distancing and the quarantine to try to protect that to some extent. And it's amazing to think that, the U.S. would be in such a predicament, but it is in such a predicament. And part of that is based on the economics and the incentives that are provided in healthcare.
Yeah, in a more concrete sense, I mean, I absolutely agree with you. And we're here in Madrid. I've lived in Spain for a number of years, and I'm from the UK. And unfortunately, in both cases, public health is something very much taken for granted in a lot of ways. But on the other hand, the US remains one of the few developed countries in the world which does not have a universal healthcare program. And bearing in mind some of those astronomical prices outlined by your employee, are there any concrete changes that you would like to see made to the American healthcare system that you could share with us?
Well, obviously, one person's opinion here, but I'm in favor of a universal healthcare system that creates a standard base of treatment, no matter how young or how old you are. One of the nuances I can tell you about the U.S. healthcare system as well is that the elderly have significant issue in access to healthcare and the costs associated in that, we're mostly privately held, but, over the age of 65, you move to Medicare. Well, Medicare, coverage is reasonable, but not adequate. And your costs of healthcare go up significantly at a time when you've retired, for example. And personally, I don't believe that is how we, treat our citizens who have, worked their entire lives for the betterment of this country, and put the country where it's been at for the last 60 years. And so I think universal healthcare, where there's a baseline, is a very good idea. Having lived in the U.S. And believing in some of the autonomy, I'm also in favor of should you have the availability and the means to something new, something experimental, something advanced, that would go above and beyond what the baseline care would give you. The baseline care would be the standard of care and excellent care, but you could try experimental things honestly, should you want to do so and have the ability to do so. So, obviously very radical things that are very difficult to achieve, but I do believe you need that. Absent that, you are going to see, things like even young patients who do not have insurance and astronomical costs that they're simply not going to be able to pay.
And of course, there have been past efforts to push in that direction for universal healthcare, which have probably not reached as far as we would have hoped they'd gone. Do you believe that now, perhaps, given the the huge effect that the coronavirus has had in the United States, that it's going to be easier to make changes in that direction?
I don't know. I think that the dynamic in the United States and Americans is just different. There is a strong, and then I think this crosses party boundaries. By the way, this is not a partisan impact. Again, all of these are my own personal opinions, not necessarily reflective of Pierian DX, but I think Americans value their autonomy, their independence, their innovation, their capitalistic approach. And that becomes very difficult to, let's say, harmonize with something that's more like universal healthcare. I don't think that there's been some mind shift in Americans either. I don't get that sense. If anything, the quarantine has been very difficult to maintain, to manage expectations of Americans. And I don't know how, Spain and the UK are, but I know how it was in growing up in India. Something like this, is a big deal, but it's not that big a deal. There have been lockdowns for other reasons, religious riots, wars, things of that nature that, I think that the United States and its citizens have just not had as big an experience in, quarantine or a curfew. I mean, these are just not things you ever hear about. And so it's very difficult when that's kind of put upon you, as has happened in the pandemic.
And of course, remote working is not the kind of only new thing we have to get used to. Far from it. I think not just in terms of washing your hands, but I think health in general is going to be a part of everyone's collective consciousness as we come out of this. And do you think that this will actually make people more interested in, for example, having their genome sequenced?
Yeah, absolutely. I think that part I could absolutely see, because it's not clear to me. Obviously the folks in their mid 40s, mid 50s, 60s are very concerned and engaged about their own health. I remember my own younger days, not so concerned. But I think this pandemic would have everyone much more, let's say, engaged in their own health, in their own susceptibilities. And I think the genome has the most tell you about that today.
Mm-hmm. I think some people might feel quite intimidated by the prospect of actually having their genome sequenced. I wanted to know, just as a matter of curiosity, have you yourself had your genome sequenced? And if not, would you like to?
Yeah, no, it's a great question. I have not had my genome sequenced. I would have no, let's say, fear in having my genome sequenced. But I also don't necessarily have a big drive to have my genome sequenced. I'm not quite sure I would be representative of my peers in that. I think there's a lot of curiosity of your own, personal, susceptibilities. I'm just much more focused on how I can impact, people more broadly. I'll just put it that way. If I did get sick, absolutely, the first thing I'd want to do is say, hey, I want to know what that result is, and I want to be able to interpret it myself. I certainly will get engaged, and I've done that before for loved ones as well as close friends where, they've had some component of genomic testing, and I've looked at the results and the like.
I think it may be one of the perhaps biggest ethical quandaries when it comes to genome sequencing, because the idea is who should have and who does have access to this data. Peter Diamandis, executive chairman of Singular University, has said when talking about life insurance, for example, it's going to be difficult to ignore genome data because your DNA is your medical future. It's predictive of what's likely to afflict or kill you. Now, who is currently able to access the data, for example, offered by Pierian, and who do you believe should be allowed access to genomic data, and how, if at all, should it be regulated?
Yeah, great questions. Today, one of our very strong differentiators, as you know, is our knowledge and our data sharing network. Our customers have willingly and with both their feet voted to share their data in our network, and the purpose of that sharing is for clinical improvement, and it's focused on clinical improvement, and then that's really the most, let's say, the easiest way to rationalize data sharing, i.e. our network, you are able to understand information from data across the network, excuse me, and use it for clinical care purposes and clinical care purposes only. So the system doesn't even let you allow doing other things in the system that would be research-like use. Now, we have the rights to engage our customers for research activities, meaning ask them for permission, get permission for research activities, and those are very active conversations we're having because we now have amassed a large enough combined data set where a secondary research use of those data would be immensely valuable in advancing healthcare. But we have to do that in a very careful and responsible manner as we expand that capability. My own personal beliefs here have been influenced significantly by my work at Washington University and the institutional review board where I worked with there, and I firmly believe that the patient is the owner of their own medical information, including genomic information, and that any research that's performed by healthcare organizations or commercial entities like ourselves are governed by institutional review boards, and in the U.S., the Office of Human Research Protections at the Department of Health and Human Services. And those folks ensure that patient privacy, patient autonomy, and patient decisions, including informed consent, tiered informed consent, are all components when you get to this type of data sharing, especially as broad as a whole genome, all of their medical records, things of that nature. And the only way that I've seen that you can kind of get your head around it is in a context-sensitive basis, i.e., hey, my genomic data plus my clinical data are going to be used in a particular context of research and limited to that context. Yes, I approve. No, I don't approve. I don't approve for any research use. I don't want to know the results, or I do want to know the results. These are all components of informed consent that should be deployed as part of any broad data sharing collaborative. It's certainly the way that we think about expanding data sharing for additional purposes than for clinical care.